Good evening and welcome to Aging Matters, a program hosted through Berks County Area Agency on Aging. We are located on 633 Court Street at the County Services Center on the 8th floor here in Reading. My name is Carmen Colon and I am the Community Outreach and Education Coordinator. Today's topic is addiction awareness in the elderly. And we have today with us our guest, Drew Eisenhauer. Thank you for being with us,
Thank
Drew.
you, Carmen. It's nice to be on BCTV as a guest.
Thank you.
I host my program every second Wednesday, but tonight I get to be a guest, and I'm excited about being here tonight. Thank you for having me.
Thank you so much for being with us. And Drew, he is a program representative. However, he has a vast experience, which he will share with us briefly in a few minutes. But he works with Council on Chemical Abuse.
That's correct.
Drew, can you please give us a little bit of background with your you have over 20 years experience.
20 years with the Council on Chemical Abuse, not 7 years, I think 5 years with the National Council on Alcoholism and Drug Dependence, which merged with the Council on Chemical Abuse in 1995. And before that, I was at then Caron Foundation, now Caron Treatment Center. I spent some time there working, made a complete career change 26 years ago, and haven't looked back since. A little bit about the Council on Chemical Abuse. We are Berks County's what's known as a single county authority, which means that we're responsible for the planning of treatment, prevention, and intervention services for the Berks County people, specifically treatment services for the publicly funded client. So we're very invested in treatment, we're very invested in early intervention services, and of course prevention of drug and alcohol, and not just drug and alcohol addiction as best we can with all types of addiction, but our primary focus is on drug and alcohol. So that's what we're all about, and we're here to serve the Berks County community, and I think we were established in 1972. I'm correct. So we've been around for a long time.
A long time. Yes, yes. And I actually had the opportunity to be present at one of the presentations you did for one of the programs that our agency has, which is Berks Link. And it was an outstanding and very informative, and this is what we're trying to give the viewers here. And if anyone that's watching the program has any question for us, please dial 610-378-0426, and we'll be able to answer any question that you have in reference to today's topic, which is addiction awareness in the elderly. Now, you gave us information on who you serve. Now, in reference to age, is there a specific age, or what are the ages that you serve? I know our agency, we provide services to seniors that are 60 and older here in Berks County.
Right.
But what age do you provide services?
The council is invested totally in the areas of prevention, treatment, and intervention. We believe, specifically when we talk about prevention, it's a cradle-to-grave type of thing. It's something that has to be consistently spoken about, consistently there are changes that are made, so we need to make the public aware of changes as new discoveries come about. But we are one of those people that believe this is a public health issue. And as a public health issue, as many people as we can tune in and keep aware of the problem, the better. So we do have programs specific to early childhood. We have programs for elementary, middle school, high school. We do works at the colleges. We do work with parents. We do work with seniors. So we focus our efforts on all people.
All ages.
All ages, because we know it is an illness that can impact anybody at any age. Yes, absolutely.
Now, when we talk about addiction, there's also another word that we associate the addiction, like a habit.
Habit, right.
let's say, for example, I like to drink a cup of wine every Friday, then I increase it to every Saturday. No, but it's my social Friday and Saturday, and I continue. So can you explain to us the difference between a habit and an addiction?
An addiction, absolutely. And I think it's important that when we talk about addiction, we address it as an illness, a brain illness.
Okay.
You know, we know that it is a disease, and the affected organ that we talk about is the brain at a most primitive stage, the most primitive area of the brain, which is that limbic region. And the difference between addiction and a habit can be characterized by loss of control and by craving and by withdrawal. Now, one of the things that I talk to people a lot about, there is a difference between addiction and dependence.
Okay.
An example might be a person who has surgery, goes to the doctor, and the doctor gives them pain medication, and they take the pain medication for 2 months, and the doctor says, okay, we're going to pull you off that pain medication. They begin to experience some symptoms of withdrawal. They may have some uneasiness, say it's a synthetic opioid, where they have some uneasiness in their stomach or some chills or whatever it may be, very symptomatic of an opioid withdrawal. But once they process through that, craving doesn't exist. Now, with addiction, once you detoxify or once you remove the substance or the behavior, the craving can continue to exist, and there's ways to address that. That's why treatment or support is so important with addiction, as opposed to, say, a habit, which could be, I'm used to doing something, like I said, a habit could be every Friday night I get together with my friends, we have a couple glasses of wine, and I'm into this routine or habit of doing that. But if you miss one of those weeks, you might realize, why I missed it, but you're not going to feel a sense of craving and desire to be there.
Okay.
So it is much more, addiction is much more than just a habit. It is something at a biological level that separates those that are not addicts from those that are.
And which are the most commonly known addictions?
Well, when we talk about addiction, the one that's still the greatest impact here in the United States is still alcohol addiction.
Alcohol.
Alcohol addiction definitely is the number one. Well, that addiction causes more financial mayhem, but the most common addiction, I need to step back on, is actually nicotine addiction.
Oh, okay.
But nicotine addiction is, again, it's a drug addiction. It's an addiction that needs some level of treatment. Most times there's protocols that are acceptable and have been demonstrated to help people quit the addiction to nicotine products. But more people die as a direct result of nicotine addiction than any other drug. But when we talk about damage and cost to society, the one that still rings up the loudest is alcohol addiction.
It's alcohol.
Yeah, it's still alcohol.
Alcohol. And I know there are several other addictions.
Well, yeah, we talk about alcohol, we talk about drugs, and a drug is anything you put into your body that prescribed or non-prescribed that changes the way the body works. People can become addicted to over-the-counter medication. They can be addicted to those prescribed medications. We also talk about, especially recently, we've begun to talk a lot more about gambling addiction. We have food addictions, we have sex addictions, work addictions. What I tend to say is anything that can make a person feel better or change their mood, elevate their mood, and cause a sense of ease and comfort can, in some cases, become addictive. I mean, we have people that are addicted to technology and computer addictions, and I sometimes wonder about a lot of people addicted to texting on their telephones all the time.
Yes.
But we do know that it actually changes the way the brain works.
And we do see that often with the new technology.
That's right.
And especially with this other new games that come out too on the phones. That could be another way of. So there are numerous addictions out there that people, which leads me to the next question.
Sure.
How do I know that I have an addiction?
Well,
How do you?
yeah.
Is there an assessment done?
There are assessment tools that are, yes.
What's determined?
There are assessment tools out there that are very useful in determining whether or not a person has an addiction. One of the things about addiction, one of the most glaring characteristics of addiction is denial.
Yeah.
And denial is that psychoactive component that disavows the negativity or the negative consequences that occur in a person's life because of their use or because of their behavior. Now, denial is a normal reaction a lot of times when people are confronted with the truth. You know, someone tells you the truth and you're uncomfortable with the truth. You might pull back from that. But when a person is healthy, they begin to see that perhaps they're telling me what they're telling me is real. But with denial, the sense of with denial and addiction, the sense of rationalization and justification is way beyond the bounds of normalcy. So the question about tools, there's some very simple tools out there. Years ago, there was a tool that the doctors would use called the CAGE tool, the CAGE survey. You know, C being, have you ever tried to control your drinking? Do you get annoyed when people talk to you about your drinking? Do you feel guilty when you get finished with the drinking experience? And have you ever had an eye opener? And that was a simple screening tool that they used to use with people. And people would say, well, yeah. Well, maybe you need to take a look at that. But most national organizations that deal with different addictions will have screening tools. The one thing I typically say when the use of drugs and alcohol or some type of behavior begin to interfere in what we call normal social functioning, or occupational functioning, or you're getting to legal problems, life is starting to get a little topsy-turvy and upside down, you might want to take a look at that behavior. But the thing is addiction, again, goes in stages. And also, I'm not as bad as that guy yet. You know, the yet thing is what I say. Well, give yourself some time. You may get as bad as that guy. Yeah.
It starts slowly, and it could eventually start increasing until it gets...
And it's very deceptive in nature. Very deceptive in nature. It is one of those illnesses that tell you you don't have an illness. Right? And one of the things in working with people that have had addictions and are in recovery now, they will find all sorts of reasons to blame the problem on, well, it was my wife, it was my husband, it was my mom, my dad, it was the boss at work. A lot of different ways they can defray or deflect the true cause of the problem.
Now, if I see a friend, a neighbor, or a family, a loved one that I think, I have not assessed the person, but I think that has an addiction based on probably some difference that I have seen on their behavior and on the attitude, on the daily life, how can I help that person?
Well, the one thing that we never want to do with a person that has an addiction is to try to guilt or shame them. That doesn't work. It just causes a greater spiral. But with the loving conversations, let's say, perchance, Carmen, that you were once an occasional couple glasses of wine on Friday night, and all of a sudden you begin to drink 2 bottles of wine on Friday night, and Saturday mornings you struggle to get out of bed, and you drink a little bit on Saturday and maybe some on Sunday, and then Monday through Thursday your emotions are real unstable, you're just miserable, and you get into a lot of conflict. That we may want to take a look at what's going on there. Yeah.
Well, thank you so much, Drew. We'll be going on a break.
Okay.
And we'll continue after this message.
You're watching bctv.org. Be informed, be involved, be a member. For membership information, go to www.bctv.org/support/membership. For other stories and information, go to bctv.org.
Welcome back to Aging Matters. Today's topic is addiction awareness in the elderly, and our guest is Mr. Drew Eisenhauer. We have such a terrific subject here.
Yes, we do.
And we left out, and how can we help those loved ones, that person that needs our help with the addiction?
Right. One of the things also, and I'm glad we're revisiting this, is the process of enabling. And enabling is a term that is used whenever an individual disallows the person the natural consequences of their actions. That is someone who has a drinking problem and they have a hard time getting to work on Monday morning, so you as the concerned loved one pick up the phone and call them off sick at work. Well, there's a reason you might do that, for fear of the own economic insecurity that they might lose their job. When a person begins to step in and do for those that they should be doing for themselves because of a addiction problem, we're doing them an injustice. And the reason I say that is consequences are paramount a lot of times, and the reality of life is paramount at times to move the person off that square so that they begin to realize that the addiction exists. Unfortunately, we're socialized in our society that we want to help. And sometimes the best way to help is not to help.
Not to help.
and it's easier for me that if I'm not emotionally tied into the person, it's so much easier for me to step away from that. But if it's a child or if it's a spouse or a mom or a dad, we don't want them to get into trouble, so to speak.
Exactly.
We need to present the truth to people in a very caring way, and there are intervention services that are available here in Berks County. And fortunately, the A&E program intervention kind of gave everyone a pretty general idea of what intervention is all about. It's a planned process with a professional and loved ones of the person, where they can present in a caring, considerate way the reality of what's going on in their life. As I said, denial is a thick wall, and it takes a lot of truth to chip away at that thick wall so that the person can see what's really going on in their life.
So giving them our support.
Support
and
is,
how
yes.
about like if we want to help them, but if we tell them or suggest to them, okay, whenever you are ready, let me know and I will be there for you. Would that be a good idea, or would that be just letting them continue the path? Would that be helpful? Or
the thing is about the person that has the problem is, I'm here to support you, but you're going to be the one that has to do that work. I can be the support system and encourage you to do what you need to do, but again, the problem, not to say a problem, the situation with addiction is it's a very powerful emotional disorder. And of course, as a parent, you know, let's say I have a son or a daughter that's an addict, and I don't want them to get hurt. So I may bail them out of jail. I may step forward and pay for their legal counsel when they need to have something done in their life, because because if I don't, they might miss a future opportunity. Well, the reality of it is we want to do what's best. And I tell people all the time is, how far would you go to help a person that was suffering from cancer or diabetes or another chronic illness? You'd do the right thing with that person. But with addiction, sometimes it's really hard because of so much emotion that goes along with that.
Now, are all these treatments, are they the same for everyone?
No.
Do they all get treatment?
Well, not everybody. So there used to be an adage in the treatment field that everybody went to treatment, inpatient treatment, for 28 days.
Oh, wow.
And then all of a sudden we said, hey, why is everybody going to treatment for 28 days? And we began to examine the level of the addiction. You know, there's early, middle, and late stages. There's some people that confined inpatient treatment program is probably the best thing for them, where there are others who could benefit from, say, standard outpatient or an intensive outpatient program. What's demonstrated in the addiction treatment field is what is the least intrusive level of care. We want to keep them functioning as best they can, but oftentimes, especially as people progress into the later stages, a hospitalization or a detoxification and some inpatient care might be necessary. But not everybody is going to say, hey, we're going to send you 28 days away to treatment or 40 days away to treatment, where that might be overkill. Right? I mean, if you have a small laceration, you wouldn't call in the surgical team to stitch it back up. A Band-Aid might help. Where if you had a large laceration, you'd need medical attention, medical care to take care of it. So fortunately in Pennsylvania, we do have a criteria that measures the level of impairment, and we can refer people to the most appropriate care. Now, if they fail at that level, then of course the next thing would be to bump them up to the more restrictive level. So we're fortunate in that area there, and treatment is different for different individuals. We often find that young people, adolescents and young adults, benefit much more with long-term care than if you have, say, a senior who's been living the life, you know, what we say normal life, you know, socialized and doing real well, and then they slip into an alcohol addiction, and it occurs in their life. many times they'll be may need a shorter length of care because they've got a lot of the social skills and the supports, and they were used to being involved in certain things. It's a question sometimes they say to people, or a statement I'll say to people is, so for some people we rehabilitate.
Okay.
For other people we have to habilitate because they didn't have those skills to get from the get-go. Or some people had great skills and all of a sudden, boom, they hit the bump. They become addicted, and we get them into a treatment program, into some level of care and support where they can move back to where they were before and become that citizen again. And part of society.
Yes, and that's a great.
And we do know that age appropriate, gender appropriate is very useful when we look at the treatment of addiction.
Okay. Now, looking at, for example, like I mentioned at the beginning of the program, that our agency provide services to seniors that are 60 and older here in Berks County. The older, generally, I don't want to say everyone, but the older we get, we tend to take more medication.
Absolutely. Yep. I've reached that point in my life now, yes.
I'm almost there too.
Yeah, 20 years ago I didn't take any medicine, you know. Now I take a couple pills in the morning with my multivitamin, yes.
Okay, so how would that, briefly, how would that affect a person that's taking 2, 3, 4 medication and all of a sudden they also like to, on the social life on Friday and Saturday, include their medication with the alcohol?
That's a great question.
And then the elderly.
That's a great question.
It could happen to anyone, but specifically to the elderly. You're
right, and as I've aged, like I said, I am now one of the part of the generation. I'm 59, so I guess I'm a young senior now. I know that as a person ages, they take more medication, and it's very important. Very, very important if you're prescribed medication to talk to the doctor or pharmacist and say, if I'm taking this medication, once a week I go to play pool or cards with my buddies and we have some beers, is it okay that I drink with this? The answer may be no, because it could be contraindicated, it could negate what the drug is designed to do, or it could cause some more serious problems. Not just prescription medicine, but over-the-counter medicine like Tylenol and alcohol are not a good combination for the liver, or aspirin and alcohol is not a good combination for the esophagus or the stomach itself. So we need to be careful, and I would say check with your doc or your pharmacist if you're not certain.
Okay.
Yeah.
Well, thank you so much.
Well, thank you for having me on the program.
For being with us today. So if you have any question for Council of Chemical Abuse, what number should they call?
610-376-8669. Extension 123. That's my extension. Thank you.
So you can speak directly with Drew. And on another note, Andrew, you know that April is the month, of course, of alcohol awareness, autism, stress. What a bad combination, stress and alcohol. Cancer control, child abuse, and it is also Volunteer Recognition Month. So I want to give a special thank you to all those volunteers that has come through by our agency in different aspects, like the senior Christmas Day dinner, our ombudsman, our foster grant parents that have helped in one way or the other in the volunteer programs or in these other events that we have in during the year in our agency. I also want to remind the viewers that the Reading Housing Authority opened the public waiting list. So if you have any questions or you would like to download the application, it will be open as of tomorrow, Friday, at www.readingha.org. And do you know someone that's 100 years old?
Do I know anybody that's 100 years old?
No,
I don't know anybody. No. Not personally.
Do you, the viewer, know of someone that is 100 or older, or is going to be 100, or is over 100? If you do, please contact our agency, Berks County Area Agency on Aging, at 610-478-6500. And we are having an event for them on May 8th. So please, if you have any questions about today's program, about the Centenarian Luncheon, also the Senior Festival of the Arts is currently looking for Berks County artistic talent. So if you're 55 and older and you're artistic, you like painting, wood carving, please call Nancy Lemahart at 610-376-5866. And once again, thank you for watching Agent Matters. And if you have any questions, call Berks County Area Agency on Aging, 610-478-6500. Goodbye, and see you next month.